to one and all present over here.
Good afternoon, ma'am.
So we are here to start the Empower Hour. That is a very powerful program from Association of Nurse Executive of India, which is established in 2017 and continuously engaged in the activities of service, education, and research. I'm sure many young girls who joined in this association feeling the empowerment. And particularly this Empower Hour for this year, 2024, we are focusing on the patient engagement. So if we involve patients' rights and patient family, we feel that we can give them, better care, better opportunity, and making them aware of their rights. And this is not a seminar or webinar, something that is called talk show. In this talk show, it is like, yes, patient is the central part of it. And we are having the doctors, medical professionals, we are having the quality control people, we are having the nursing officers, we are having all the people involved in the healthcare industry. We already started from the month of January 2024, and we are here with the West Bengal, powerful West Bengal chapter. Yes, Captain Madhukari Ray is here. She will take forward. I'll give her after 3 minutes to her. So just to, talk about the progress of the ANEI, I feel that we have reached much more than what we have imagined. And we all we are aware about to develop the leaders, to take the professions forward. The mission, vision, who are already the members of ANEI, they all know it. And we are working, holding hand in hand with all the professional, each of our ANECON, we are considering the professional from different fields. And we have the different chapters in our country, and we have our founder officials, who is, I can say, brainchild of Madam Thankam Gomez, Dr. Jyoti Clara ma'am. Madam Thankam Gomez was the founder president. Jyoti Clara ma'am is the founder vice president. Subhara Sakurika ma'am is the national secretary, and Captain Ajita Nair ma'am was the national treasurer. Now she is the national president, and I as Unmona, vice president. Vinci is the national secretary, and Colonel Azi is the treasurer. So with this, we have already started talking about the Empower Hour. Northeast chapter, Punjab, Tamil Nadu, Kerala, UP, we have crossed, and we are coming to almost to the middle, and the vital and very strong group of West Bengal chapter. They're very proactive out of the hectic schedule. They do a great job. And next month, we are looking for Jharkhand, then next Haryana, Delhi, Telangana, Karnataka, and Maharashtra. So this is the pace I'm leaving to the West Bengal chapter. I request Madam Captain Madhukari Ray, Director Nursing Eastern Region of Apollo Multispecialty Hospital, President ANEI West Bengal Chapter, who is actively leading, and she is also the founder member of ANEI. I would like to hand over to her to take this talk show forward. Ma'am Madhukari, may I hand over to you? And I'm stopping the slideshow here.
Thank you. Thank you, Dr. Unmana. It is a pleasure for me to lead the West Bengal chapter as president of chapter president of ANEI, and also I am indebted to the Association of Nurse Executives of India for hosting such Empower Hour, which actually not only enriches our knowledge, but also gives us a lot of insights to know and to understand how patient safety is important for us, and why patient safety is to be taken as a prime importance. So with that note, my sincere thanks goes to Madam Thankam Gomez, who is the pioneer of this independent body, the brainchild of hers, and along with that, the team of now current president, as Dr. Unmana said, Captain Ajita, and the entire team of ANEI in the country, and all the chapter heads. My sincere thanks to all of them to really create lot of such good work. And today, as the West Bengal chapter is coming up with a very good topic, where our today's theme is engaging patient for oncological safety and rehabilitation, where we are going to, and especially these empower hours are centered towards patient safety, keeping a patient in the middle. So our main focus is our patient, who will tell us what is their expectation from the caregivers, which actually takes us to a different tangent altogether to understand from the patient's point of view. Because if we are empathetic, then only we can give the best care possible that to be given to the patients. So I really have my sincere and hardcore thanks to our patient today, who has courage and who has been willing, has become so proactive in attending today's session, Mr. Shekhar Bhattacharya, and who is actually taking us through the entire lead of today's program, and will tell us what is his expectation, or as a patient, his expectation from all of us. We are looking forward, we are excited to hear from him, because oncology is a subject which actually is not, it is in today's days, I think every hospital is dealing with oncology patients, every hospital. So how we are looking at it, whether we are looking at these patients care from the right perspective or not, I think today's session will give us a lot of such insights. So without much ado, I will request Dolly Bishwas, who is the chapter secretary for West Bengal. Dolly Bishwas is the chief of nursing, Fortis Hospital, Anandapur, Kolkata, in West Bengal, and she has a lot of accolades in her kitty. I would request Dolly to take over from this and start the discussion forward. Thank you so much.
Thank you very much. I am privileged to have this moderation today with the panel, where we'll be dealing with the oncological safety and rehabilitation, as you have got to know. So I would like to just introduce with the panel Captain Madhukari, and thank you to Dr. Unmana, who has given us the opportunity to conduct the session. Thank you, Captain Madhukari, as the president of Bengal chapter. So I would like to introduce first with our panel member. Already Captain Madhukari had introduced our beloved Mr. Shekhar, who will be with us throughout and who has given his consent. Sir, thank you so much for joining with us today. Thanks to Dr. Jibak. He is the doctor consultant of radiation oncology from Apollo Hospital, Kolkata. And sir will be with us throughout with the panel. I will have in our panel Ms. Shiparna Giri, who is the ANS, that is Assistant Nursing Superintendent, come Assistant Professor of Tata Medical Hospital and Tata Medical Center, Kolkata. So welcome you, Shiparna. With me, we have our Patient Welfare Department head. She is Ms. Rakhi Sinha Mitra. So welcome you, Rakhi, for the panel. We have with us Ms. Sravani Mukherjee. She is the head of dietetics from Fortis. So Rakhi and Sravani are from Fortis, Kolkata, Anandpur. So without wasting any time, let us take to the discussion, because time is just 1 hour. We have to cover up within the time. And we know this cancer is very much prevalent in India. Almost 1.47 millions of people are suffering with cancer. And this, the disease which is increasing every day, that is the Indian statistics and globally as well. So, Mr. Shekhar, welcome you for the session. Sir, as a patient, what is your expectations from all of us, those who are caring you, from the doctor, from nurses, from dietitian, and from, patient welfare officer or counselor? What is your expectation from us? If you just can elaborate with your own thoughts.
Okay, thank you, madam. I really congratulate your organization to invite me and hear all this very notable and really extreme other topmost expert they are attending. My name is Shekhar Bhattacharya. I'm 71 years old. By profession, I am an engineer. I'm suffering from multiple myeloma since 2014 onwards. I'm still on treatment, and I have gone through all the treatment procedure, including my bone marrow transplant. But I want to start with that. I am normal. I am very active. So far, my professional qualification, the requirement is there, and socially also. In fact, today I took the admission for my chemo tomorrow. My first reaction to that, particularly on the caregiver, I am happy. But what I want to say, more development is required so far caregiver and the nursing staff, those who are involved to take care the patient, whether it is a newly patient or old patient. My suggestion is they should go to the respective file before approaching to the patient. It is very important. What I mean to say, if the old patient, they should go to the last discharge summary. If it is a new patient, go through the doctor's prescription. They will have a very clear-cut idea of what type of treatment is going on. This is very important. Second thing, I have one more observation, that they should be very polite and also give the patient's hearing to the patient. Whatever problem they are feeling, what are the feeling they have, and somehow they have to assess the patient, psychologically and approach-wise also. These 2-3 things, it varies. So this is one. Or totally, I can tell you that I really appreciate the nursing staff in the same hospital. They do the really very good floor management. This is not only the nursing care; it involves, housekeeping, then FMB, and major role they liaison with the pharmacy. They ensure timely availability of the patient medicine which is prescribed in the prescription or in the discharge summary, and 2, they take care the collection, issuance, indent res for the chemo. And my experience, if doctor told that it should start at 8 o'clock, ma'am, I want to say they start at 8 o'clock. After completing their formalities of mixing and other things. This is a great thing, I must say. What are the good thing I must definitely tell? There is no question of, the negative issue. But floor management is also another area which is very much needed. So that is, and as I told you, that little bit study. Yes. Because when they come during the shift change, they may not get the, because most of the patients are critical. And if it is a senior citizen, they always expect that people should come immediately and take them in the care. So that study is very important.
I must mention one thing here, though Dolly, you are moderating, but when I was talking to Mr. Shekhar, he showed me a document of 16 pages from 2014 till date, when whatever has been done on him, whenever he came for visit to a doctor, whatever investigations have been done, whatever treatment have been given, whatever visits, and whenever he visited, what is the update? Everything is there in this 16 pages. It is like encyclopedia of Mr. Shekhar Bhattacharya, which can be given to anybody across the world to refer, to have a second opinion, and to do anything that you want to know about Mr. Shekhar Bhattacharya. And that he himself started, and his wife is continuing that. See the level of engagement that he has. And it is such a contribution for the caregivers to know about him at one go. So this is something praiseworthy. I really learned from him how to maintain a record.
Sir, hats off to you. And thank you, Madhukaridi, for adding up, sir. And you have said the safety that we need to have in our mind. You have mentioned everything, reading the discharge summary, prescription, doctors, what he has written it, how he has prescribed. Pharmacy has to be ready with the medications. The floor manager has to listen to the patient, what patient need. The nurse has to promptly start. Dietitian has to be conscious about what food to be given. So, sir, everything create patient safety. Thank you very much. Very beautifully you have explained. So now I will think.
Ma'am, I have one more point. If I don't mention that, I will feel really bad.
Yes, sir.
The role of dietitian. I give so much importance to the dietitian's role. Because I know 2014 onwards, when this chemo or targeted that it was started, I know what was my condition. And what I am today, I walk at least 3 to 4 kilometers daily. I do the trekking. I visited 2 times Ladakh for my professional job. I'll tell you, doctors, great. Nursing staff, great. But we should not forget the dietitian. They should bring to the proper level and free hand to approach the patient. That is very, very important, I can say. Don't take it, Dr. Dibak is there. I don't want to mention in my comments. You take the ghar ka khana, less oily, less masala. But dietitian is the real, they write, I have magnesium shortage problem. My dietitian told what are the food I have to take.
Oh, super.
It is a great. I am telling you, I put them in a different level. So my humble request to you, kindly ensure that dietitian should get the proper responsibility and free hand to do it.
Oh, great. So that autonomy has to be given to the dietitian, which you wanted to say free hand, freedom to be given to decide the diet. That is what you said, sir. Sir, thank you very much. We will take the question with Dr. Jibak now. Dr. Jibak, are you there?
Yes,
you can just, Thank you, sir. Thank you. Most welcome for this session. So, sir, for you, you have heard Mr. Shekhar thoroughly. So now, how can we remove the myth and social taboos related to post-chemotherapy effect? What is your thought about it? How can you make the patient safe out of this taboo and myth?
First of all, I'd like to thank you for including me in this wonderful session. So I'm really honored about that. And listening to Mr. Shekhar was an amazing experience. He has, as Captain Madhukari also said, he has maintained the record, and it's really, we are really fortunate to have a patient like him. If all the patients can actually maintain their history and they are aware about what is going on, and they can be looking into everything of every part of it, this is real engagement, what we really need, because Absolutely. It is cancer therapy is not something which is one-sided. It requires involvement of the patient and patient family members, everyone. Now, coming to the myths and social taboos of chemotherapy, cancer therapy and chemotherapy. So I have identified a few areas which we should look into. One is that, first of all, the most common problem what we face is that there are a lot of idea that the patient or family members get from non-medical persons outside the environment, from the neighbors and other things. And all those information may not be correct, because most of the informations are based on either their experience or some hearing from some other patients, but not the first-hand experience. The problem is that this kind of misinformation actually makes creates a lot of fear in the patient's mind, and that is actually may not be applicable for all the patients. Yes, some chemotherapy drugs are there, some targeted therapy are there which are toxic, which creates complication. I'll not say those are very very easy drug to take, and cancer therapy is a long treatment. So it is also necessary for the patient to cope with this long treatment. It's not a one-day treatment. It goes on following months. So, so it is important for the patient and family members to understand what exactly the treatment can do, rather than hearing from anyone who does not have any experience. Just out of fear, they are talking this, oh, chemotherapy is a horrible thing. It is very painful. It will have a lot of effects on your physical appearance. It should not be given. That will cause more harm. Even we often fear people saying that do not go for a biopsy because biopsy will cause more spread of the tumor. You should not go for biopsy. Again, some people say cancer is a contagious disease. You should not be with your family members during this therapy or something. So the problem is that this kind of myths or wrong information actually delays the patient treatment, decreases their courage, and rather than encouraging, they decrease their courage, and it becomes an obstacle for the treatment continuation. So complications will be there. The best person to communicate is the medical persons who are taking care of you. Yes. The doctor under whom you are getting the chemotherapy, he is the best person to tell you, he or she is the best person to tell you that what are the possible complications, what are the most common complications that will happen and when that can happen, what are the expected complications, what are the rare complications, and that they will ensure definitely that there are medicines for those complications. And definitely we are there for you so that you can fight on those times, because we know that this is a difficult time. We are not saying that it will be very easy, but we are with you. We will be with you. Not only the doctors, all the teams which we are talking about, everyone will be there with you. Definitely, you will feel the most. But still, this is important that you have the communication properly with the team who is taking care of, rather than listening to the other person who does not have experience.
Yes. Thank you, Dr. Jiba. Very well said. You have very beautifully narrated that engaging patient for their safety only possible when your patient's mind knows about the exact complications or the related to the therapy, how safe it is and what is going to go when it's inside the body, how it's going to affect.
Actually, so they can report early if they are aware that this is the problem I can have post chemotherapy. They can report early also.
True. So that is the great patient engagement when they report early that they are having such problem. Thank you so much. Now, Shiparna, are you there? Can you just put on your camera? You enable your camera, please. Shiparna? Already video is on, ma'am. Thank you, Shiparna. Shiparna, every day you are handling hundreds of patients in your daycare in Tata Medical. What a great job you are doing. Shiparna, you face many type of patients. So how can you, engage patient for their safety psychologically and removing fear, anxiety to their mind, which you are doing every day? Can you just narrate your experience that how you are going to engage the patient for safety? Enable your audio.
Hello, can you hear me?
Yeah.
Okay, ma'am. So thank you, ma'am, for engaging me for this panel. So, and the question is very means what to say. This is for me only because I am daily, we are having 160 to 200 patients every day in our daycare. So there are different mixed kind of patients are there. Somebody who are very courageous, they are accepting the chemotherapy and coming, and few who are very fearful. So first, we have to communicate with the patient. So we are starting with communication because everybody's anxiety, fear is not for same. Because this cancer is coming because of they are coming already diagnosed with cancer. So that is very fearful word. And then they are coming for chemotherapy. So both are very fearful. So they are very stressful. So few are fearful of the disease, few are fearful of the cancer and the chemotherapy, and few are very anxious about the financial condition because they are coming for the treatment. So first we start with the communication. What Mr. Shekhar told already. So first we go through the prescription for what patients are coming for. So everybody is not for the same background or same thing. So we have to check out the patient's background. Then we start talking with the patients. We first ask about what their expectation of for what is their insight, what is there. So then we are talk about many persons having myth about what Dr. Jivak already said. So they are think that it is very painful treatment. Maximum patients think chemotherapy means it is cytotoxic. So it will be very painful when they are taking the chemotherapy. So our daycare is very open. So when they're coming, we are showing the other patients that all are sitting and taking chemotherapy. So it is not a fearful thing, anything. It is like IV only, that way you are taking fluids, hospital. So it is like that. Then we are talking about we have to put a IV catheter. So you have to, that is mild pain may be there. So after that, it is completely fine for you to be taking medication. Then they are having women's patients are having mainly fearful about their, concerned about their alopecia and hair loss. So whatever the disease, for disease, how much they are stressful, they are much more stressful about the alopecia. So we are taking the background of the patients for what they are coming. All medicine doesn't do the hair fall. So we check out the patient's medication. If it's leukemia or the CF breast, then we are telling that hair fall will be there, but you can go for wigs, you can take the scarf. So what are the alternatives are there? We are saying about that. And the disease which may not cause the hair fall. So we are saying that you don't have to worry, hair fall will not be there. And some more of hair fall is everyone is having. So you don't have to thought about that. And nausea, vomiting also, they are very cautious about, they think that they can't take foods properly, their nausea, vomiting will be there. So we are talking about that there is so much antiemetics, advanced antiemetic. Many patients doesn't have vomiting also. Oh, few are having the anticipatory vomiting. So we are giving lorazepam before and after, knowing that that patient is having anticipatory vomiting. So like that, by talking to the patients, to understanding their problem, we are giving the solution to the patients, that how they can manage with that.
Thank you. Thank you very much, Shiparna. You have highlighted many of the point, background to understand about patient detail, cytotoxic drugs. They have a fear in mind, and you are going to counsel them and saying that regarding the fear about pain or about the hair fall and all these things are together. When as a nurse you are going to speak to patient, you are going to make them with an empathetic way that how the treatment about and whether mild side effects will be there or not. You are going to explain all those so that you are engaging patient to get your understanding with two patient understanding and removing the fear and anxiety from the mind. Thank you so much.
One thing that, ma'am, we are always take the patient's relative also. It's not about only patients and relatives.
Yes. So in engaging patient relative is also important, along with what Mr. Shekhar also highlighted. So engaging patient relative also very important. Thank you so much. Great thing. So now I will take the next question. So Rakhi, you have connected. You enable your camera, please. Can I see you, Rakhi? Yes. Hello.
Can you see me?
Rakhi? Yes, thank you. So welcome you, Rakhi, for this session. So you heard about Dr. Hart with Dr. Jibak and Shiparna also said, and Mr. Shekhar. So you know all those things. You as a floor manager, as a patient welfare officer, you have every day you are encountering with a patient receiving chemotherapy, patient with oncological condition. So as a patient welfare officer, how do you engage patient for their safety, or what is your role you could play and to enlighten in this session?
First, I would like to thank you, Sister Dolly, for inviting me in this forum. See, we are a non-clinical person, right? So the nursing, the dietitian, the doctors, they are taking care of the patient in a different way. And we as a welfare officer, we try to bridge the gap between the patient and the doctors, the nurses. That's the main role we play, actually. And we try to listen, hear from the patient what they want to say exactly, like what are there in their, what are going on in their mind.
Correct.
So a kind of mental support, a kind of emotional support.
Okay. So you said that you will look after the patient. You will first of all bridge the doctor, nurse, and a patient, and
yes,
the other caregiver. Mr. Shekhar already highlighted housekeeping, dietitian, everyone, together. So you are the person as a patient welfare officer to bridge all the gap, and you want to read the patient mind, so that how the safety can be created in patient mind, and you will support them. You will talk to them, you will allow them to ventilate. So that is the role which you play in the organization.
Right, Sister Dolly.
Thank you.
Absolutely
Thank
right.
you. Thank you so much, Rakhi. Thank you very much. Now, I would like to take with our Shravani Mukherjee. She is the head of dietetics department. So, can you just enable your camera, Shravani? Okay.
Thank you, ma'am.
Thank you so
Thank
much.
you, ma'am. Thank you, ma'am, for
So-
asking me this question.
So I will ask you. Wait, the question I didn't read. Yeah. So the diet therapy is paramount important. Mr. Shekhar already said dietitian play a great role. Patients are coming with mucositis, anorexia, vomiting, nausea. So how can you engage the patient to make the safety in their mind that how the dietary factor or diet is so important because they are immunocompromised? So what contribution you would like to play or you are doing every day for the safety of the patient? Yeah.
Ma'am, for a cancer patient, the nutritional demand is huge. To fulfilling their nutritional demand, we always prescribe balanced diet, which help to maintain their healthy body weight. So, during chemotherapy or radiotherapy, we were prescribed neutropenic diet. This diet is ideal for the patient who are immunocompromised. These are ideal for immunocompromised patients. In a neutropenic diet, we are mainly suggested well-cooked food, pasteurized milk and dairy product, well-cooked food. That means we don't allow any raw food, salad, because they can get patient can getting infection for that raw fruits and salad. We always recommend well cooked animal protein like poached egg, water poached egg, half boiled egg. These are not recommended in neutropenic diet because most of the animal protein, if we take animal protein in raw form like sushi or poached from roast from, that type of protein getting problem because they are immunocompromised. These types of food may infectious the patient. So for a neutropenic diet, we always recommend neutropenic diet. In our hospital, we always suggested patient to take well cooked food, always covered food like covered skin fruit like banana, pomegranate, orange are suggested instead of cut papaya, cut pineapple, cut watermelon, anything. So these are the ideal food for cancer patient. Most of the during chemotherapy and radiotherapy, patient have some common side effects like constipation is a great problem. Most of the people complain about constipation. That time we recommend high fiber rich food. We always advise less oily, less spicy food for cancer patient because they have a digestion problem also. So for constipated patient, we also advise to drink plenty of water along with fiber rich food. Like fiber rich food like vegetables, stew, oats. Oats is very good amount. Oats contain high amount of soluble and insoluble fiber. We also suggest instead of rice product, if you have with constipation problem, go for wheat and wheat product because these are more fiber. And these kinds of fruit helps to reduce their constipation. And they have also complaint of diet also simultaneously. So yeah, we suggest less spicy bland food, small and frequent fruit, small and frequent food. That means in between feed, we also suggest little bit calorie and protein supplement. And for when the patient is suffering with diarrhea, we recommended some probiotic agent like less oily dairy. Yogurt is very commonly used for as a probiotic agent, and prebiotic food like soluble fiber rich food, soluble.
Hello, I think we lost your connection. Hello. Okay. So almost you have spoken. We have heard you, Shravani. We have heard you that you spoke about a healthy diet, well-cooked food, and anti-constipating diet, probiotic food, and you have also said that take a small frequent meal And so those are the diet which will not reduce the immunity or boost up the immunity, such kind of foods to be consumed. So thank you very much. And this knowledge you have to share with the patient so that patient can also take appropriate menu in their daily diet therapy and to have the better immunity. Thank you so much. So now we have almost one round of questions we have almost covered. Now again, Shekhar sir, the questions that I would like to take with you, that since you have a lot of experience, you have a lot of exposures, and you are maintaining such a healthy life, amazed to see you. So your message to other patients out of your experience throughout this experience, right from 2014, which you would like to share regarding the therapy and regarding the safety that you have taken to yourself. So could you please share?
I would like to mention about the patient because most of the time I have near about 40 to 45 known patients to whom I am caring, mostly the outpatient patient as a local guardian. I do the follow-up on their behalf. The major issue what I have found, even when I am staying in the sharing room, the arrogancy of the patient, those who are senior citizen, which is really troubling the nurses. They are coming with a very polite approach, giving patients hearing to know the problem, but due to their age and their position, they are unable to control it. So I have one humble request to you. Kindly have some methodology. There should not be any SOP because it will be very difficult because every individual, considering their background, educational background, then religious and other aspects, family background, this arrogance is sometimes it creates havoc. And they started firing. When the your nurses they come and they ask that how are you, the reaction is very sharp, and sometimes I feel if I am in the sharing room, I just, since I know the person, I come out and try to pacify them. Sir, why don't you tell your problem so that they can give you the best. This is one issue. Second thing, as Dr. Jibok Bhattacharya told, it has a tremendous impact of the family patient party, that a family member, relative, so-called friend, they try to misguide the patient. I mean, a lot of people, even they are sharing, what is the use of that? I know the young patient, he is suffering from the blood cancer. Doctor was suggested, why don't you do the bone marrow aspiration? The gentleman did once at Gurgaon, he refused to do it. And unfortunate part, after 3 months, we missed him. He was not, 32 years old. He didn't allow the doctor to do the test to assess his position. So this is one issue, the adamancy and the, this type of patient, arrogant patient. This is one subject. You have to evaluate some methodology, interact with their family, call them, if I'm not talking about the admission date, call them in the hospital, have some sort of psychological or whatever way you have a good counselor. So that interaction is very, very important. It is not all. Mostly, I'm sorry to mention, since I am senior citizen, it comes from the senior citizen patient. This is one. Second thing, I have a very common dialogue to my senior citizen colleague. Don't try to be a gamma when you are in the hospital. Knowing fully well their limitation after chemotherapy, they were cautioned by the nurses as well as ward boy and the senior nurses in charge. They don't go alone to the toilet, don't go just walk out, but they don't listen. And ultimately they fell down. So this is also one issue. It is not possible to put single person to the single patient. So these are the issue. Third thing I will tell you, it is I have seen as food safety. This is one. the patient party, they come with the different type of food which is not allowed to him. And it happens from it is not some community, they come with that. Lastly, I want to say, washroom is the epicenter of infection. So what is happening? The patient party, they comfortably use the same toilet what I am using.
Very good point. Very good point.
This is one issue. I objected. I cannot fight. I raised the issue. My nursing staff as well as your housekeeping and others, they also told that we'll try, but things are not happening. I shared to my patient, the co-patient, sir, why didn't you tell your family members or friend? There are a very good number of washrooms. Why you are not telling them to use that? Because
true.
That is the epicenter for the cancer patient.
Very true.
Most of the things comes, but there should be some methodology how to check it.
Sure. Thank you. Thank you so well. You have said, and your experience, because of your huge experience, you could narrate all this, that doctor-patient relation, nurse-patient relation is very important. Arrogancy should not be there, and give, explaining their own history, because, reconciliation of the medications or history is very important from the doctor side. So patient needs to cooperate. So excellent message for the group, sir. Here 105 people have joined. Really, it's very good to hear from you. And you have said that we have to always explain the patient safety in terms of patient fall. Don't go to the toilet alone, take help. And these people are not able to understand sometimes, and patient fall happens. And then another very important washroom, that from the beginning, explain the patient relative not to use this same washroom which patients are using. True, very true, sir. Thank you so much. So, Dr. Jiva, yes.
I have a very small submission, sorry to interrupt.
Right.
Why didn't you give free hand to the counselor?
Okay, yes.
They visit, but they start acting only after advice from the concern who is handling the patient.
Correct. Again.
Comes per day to visit the patient for 10-15 minutes. He may not be aware of the patient condition. As co-patient, I know he cries every night. He prays to the Almighty or God, please take me out from this. I communicated once or twice to the counselor, but only what I came to know, unless and until doctors refers, they cannot approach to the patient. I'm not talking about the system, but they should be allowed to visit all the patient to judge mentally how he is arrogant, how he is reacting. It is a normal duty. It should be a normal duty for the counselor.
True. Very true, sir. Very true. Whatever you said, it's really every line, every sentence of yours is so important. So important. Thank you so much. Thank you so much. So, sir, now my question will go to Dr. Jibak. Dr. Jibak, just enable your camera. And sir, you heard Mr. Shekhar, and you heard that whatever the physical, changes that arise or that happen, psychological part also he has very well explained related to vomiting and everything. Even for the radiation therapy also, when patient get chemo radiation both, and you are the specialist in those therapy. So how you are going to address this issue for the safety of the patient?
So, as you know, the radiation therapy is a long process. Usually it takes around, in general, from 3 to 6 weeks process. And usually patient has to come every day, and it is a daycare process. Patient has to come every day and then take the radiation and has to go. Sometimes they have to follow certain protocols like some bladder filling protocols. They have to take a certain amount of water before radiation, or they have to evacuate, or they have to have a good bowel clearance before radiation. So these are the things that usually what we do is we do everything, we tell everything clearly to the patient and family members that these are the things you have to follow every day. The next issue that is very important for anywhere where radiation facility is there, you will know the radiation machines are often out of order, or there are some minor issues for which there are delays in treatment. And the problem is that the patient comes from a long distance, they travel, and they want to go home as early as possible. They are sick. Sometimes they have appointment for chemotherapy and other things. So there are delays sometime, and for that they have to be well counseled before that there is a possible delay during the long course of therapy, because for a 6 to 7 days, 5 to 6 days a week, almost 30 to 33 fractions of radiation, there could be possible delays, and some kind of patients have to be expected from patient and relatives also. Of course, we try to manage it as early as possible. We try to address the problems. The next thing is that radiation, mostly, with our modern radiation techniques, the most difficult part where we face while giving radiation is the head neck region. The head neck region is the most common. Head neck malignancy is one of the most common malignancy of India and our developing countries. So the problem is because of the complex anatomy and the shape of the head neck region, for radiotherapy and chemotherapy, the effect is very, very crucial for the patients. And it's really, really difficult for the patient to take, because they will develop mucositis in the oral cavity. They will have difficulty of taking food. And that is also further aggravated by when chemotherapy is added to it. The chemotherapy is added because it increases the radiation effects, but that also increases the toxicity. Any cancer therapy will increase the toxicity at the same time, because they will be acting on the rapidly dividing cells. So whatever cells which are rapidly dividing, like our mucosa, that will be affected by any form of cancer therapy. The good thing is that they are replenished once the therapy is stopped. So that is recoverable. So what we need to tell the patients, and they have to understand that these are temporary things. This is not going to last. Once the treatment is over, maybe after 2 to 3 weeks, this will revert back to your previous condition. But you have to bear with this process. And there is one more problem, is that few tumors like head neck cancer tumors, there we don't like giving treatment breaks. So we try to continue the treatment as much as possible. Even if it is causing a bit of complication, yes, we weekly check the patients to see whatever problem they are having. If it is very life-threatening, we usually tell them, no, now you need to stop the treatment for a few days. You take medicines for the few days. But unless and until it is a very severe problem, which is objectively verified by a physician, not a subjective, because subjective pain and other problems varies according to the patients. So we do give analgesic and other symptomatic treatment so that the patient can continue. And most of the patient can actually continue. So have to have patience and have to have faith that this part is temporary and this we'll overcome it.
Yes.
There are other some physical appearance problem. Of course, if the radiation is given to the brain area, there will be loss of hair. If it is in the head neck area, there will be burning of the skin. So there will be skin changes, and the patient needs to follow certain guidelines that we usually, everybody will give you during the radiation therapy, that there are some restriction of applying ointments or shaving in male patients, then rubbing the area, then it's better to use non-collared cotton clothes. So these are the things that you need to remember. So it depends on which side the patient is having radiotherapy. And mouthwash is one of the very important things that you have to do both in chemotherapy and radiotherapy, to mouth rinse as much as possible with the medication or any homemade preparation that the doctor suggests you, so that you can prevent oral infection. Because most of the cases, the radiation chemotherapy patients are neutropenic often, and also there are mucositis. So there is more chance of getting mucosal infection that will further aggravate the condition. So mouthwash is very important, and even the patient or family member do not like to do it frequently, this is something you have to do it maybe 10 times a day if required. That's it.
That's great. Thank you so much, Dr. Jiva. Very well. You have explained each and every issues that usually patient faces. The most important thing you said that the patient mind should know replenishing of the normal cell will come back once the therapy gets completed within 3 weeks or within 4 weeks. And that is, if the patient mind knows about it, automatically patient heart will allow to engage with that therapy.
Yes.
Cope up with the therapy, you know. So that's a very important message that you have given today. Thank you so much. Now I would like to now take up a question with Shiparna. Shiparna, Dr. Jivak has already explained many of the education that patients should have to engage them better with the chemotherapy and radiation therapy. But from your side, patients' education, prior educations before chemotherapy related to IV cannula, PICC, chemo port, whatever you are using, those sometimes may cause certain kind of complications. So how you are going to take all those with the patient, and how you are going to explain, and how you are going to say that your safety in your hand, and what you are going to say to the nurse also when they are starting the therapy, and doctors too. So what is your thought, Shiparna? Yeah, please enable your camera.
No, my camera is enabled. So,
yeah, okay.
So when we are giving the patients, we are doing I am talking first IV cannula. So maximum patients are oriented with the IV cannula, and we are not allow the new staff to do the IV cannula for cancer patients. We never give the, yes, for pediatric, I don't allow them. For the patients with CA breast, I don't allow, because we have to reserve one hand only for the rest of the chemotherapy. So when their expertise, we are giving for the new patients to them who are not CA breast for them. Otherwise, we are showing them the technique and their practice on the dummy, then only we are allowing them. And we always, if there is backflow and the staff is confident, there is no double prick and there is no, means everything is okay, then only we start chemotherapy with that cannula. If the staff is not okay, and if there is anything, any doubt in mind, then we again double prick, means we are doing the another channel. We are asking, telling the patients, if extravasation happens, then you will have much more pain than the double second prick or the main front. So
and when patient is going with these lines, okay, PICC, chemo, what advice will you provide to them for the safety?
So for the IV cannula, when we had started the chemotherapy, everything might be happen, okay, but we are telling when they're going to the washroom with the IV cannula, so always take care of that hand. Don't move that hand too much. And after coming back, also keep eye on that hand for 5 to 10 minutes, because maximum time extravasation or swelling, those things happens after coming back of from the washroom. Or another one thing, after taking everything okay, doing IV cannula proper, after giving chemotherapy, when not taking out the IV cannula, removal of the IV cannula, asking the patient or relative to press the line for that place for 5 to 10 minutes. But if they don't press properly, then also ecchymosis happens. And if it is happen after anthracycline or vinca alkaloids, there is chance of the extravasation. So we are asking them, please properly press that one, otherwise you will suffer with the problem. So this is for IV cannula. For PICC line, we are asking the patients always check the insertion, what is the length of the PICC line, what is out, because we always mention how much is out. So always check that one, it is out, is okay, or it is coming out, or not to take at the time of bath, the dressing should not be get wet, and they should do periodically dressing. For the gauze dressing, we are telling 72 hours, but we don't do gauze dressing. If there is only bleeding, we have to need the pressure dressing, then we go for the gauze dressing, and they should come after 72 hours and change the dressing. And for the PICC line, we are doing the transparent, that should be changed every 7 days, and they must follow that one. If there is anything in between, they should come and they should show to us. And for chemo port, also sometimes it's happened when you're starting the chemo port and there is no backflow. So many times they don't want to go anywhere, but we always do the linogram before starting the chemotherapy. If patients don't want to go for the again test, another test, so we motivate them. If it will hamper, if there is any clot formation, anything is there, and again we start chemotherapy, there is chance of backflow of chemotherapy and extravasation will be there. And that area should be kept clean. They should take proper bath, everything, that infection should not be happen. And if they're having chemo port, another point, and they completed their chemotherapy, but they should come for the the flashing for chemoport every 28 days.
Thank you. Thank you, Siparna. Very good tips you have given to patient to engage the patient for their safety with the lines that they are carrying and they are having for a long time. And if they take care, then only the lines will be painted for continuously till their therapy gets in. Thank you so much. Now, questions to Rakhi. Rakhi, can you just enable your camera? So, Rakhi, what is the take-home message as a patient counselor or patient welfare officer? What is the take-home message that you would like to give to patient and their relative?
See,
Can
we always try to share our number with the patients when they're leaving the hospital, because sometimes what happens, the doctors gets busy, the nurses gets busy, they are not able to contact with the doctors or the nurses or anyone in the hospital. So we are there to get in touch with them. They can always get in touch with us so that we can talk to the doctor or to the nurses regarding their complication or regarding their queries.
Well
so
said.
we always give our numbers to the
Yes, yes.
patients.
So, they feel a lot of, satisfaction in their mind when you are sharing your number and they connect you directly. Wow, it's just wow. Like sharing them and they can talk to you. Yeah. Anything else?
No, that's it.
That's it. Okay, thank you. Thank you so much, Rakhi. So, Sravani, now question to you. Do this patient require a special diet? Though you have explained everything, is there any message that you would like to give to everyone so that patient will be more engaged for their safety regarding the dietary part?
Unmute yourself.
Yes. Can you just put on your camera again? Hello. I think some problem has happened with her. Anyway, she has already explained about the diet therapy very well. And Mr. Shekhar also added that how much it is important to have an... Yeah,
Ma'am, I am not.
please.
Okay.
Please.
I already told ma'am the nutritional demand of a cancer patient is huge. So always look after about nutrition, high calorie, high protein supplement. I already told small and frequent meal is essential for a cancer patient. So always take less oily, less spicy food in a small and frequently, but in small amount. In between, high protein and high calorie rich supplement is necessary, because these kinds of supplement provides enough vitamin and minerals during chemotherapy. Due to chemotherapy and radiotherapy, lots of vitamin and mineral deficiencies arise. So these kinds of supplement help to fulfill their demands. And omega-3 fatty acids supplement act as a anti-inflammatory property. So good fat like MUFA containing fat, any kinds of dry food, nuts, peanut butter is a very good supplement for MUFA. And omega-3 fatty acid means fish, soybean, flax seeds, walnut. These are the excellent source of omega-3 fatty acids. So omega-3 fatty acid containing food, MUFA containing food help to reduce their complications after chemotherapy and radiotherapy. And after chemotherapy and radiotherapy, patient have a main complaint, loss of appetite, loss of taste. For that reason, we would suggest to take some lemon, have a great important role. Lemon can enhance your taste and enhance your appetite also. So lemon tea, ginger tea help to reduce these kinds of complications. They also reduce the problem of nausea and vomiting. So in our hospital, we prescribe this patient with slice of ginger we send along with little bit lemon juice and rock salt. Then we suggested our patient to take in your mouth. These kinds of ginger help to secretion of saliva, and saliva secretion also help to reduce nausea and vomiting problem. So these are the small things. Keep your mind, and balanced diet and well-nourished diet have to take.
Wow, very good. Very good tips you have given.
Dolly, I want to add one thing, Dolly, here.
Yes, yes.
This is the same thing I must acknowledge that they'll let everyone know that we are doing a quality improvement project on ginger and lime therapy to reduce vomiting and improve the taste of and to prevent mucositis. This is giving us wonderful result.
My God, that's great.
Yeah.
That's great. And she said the ginger, lemon, and rock salt.
Rock salt. This
Wow,
combination is working very nicely.
Very
We
well.
are getting, and we are doing this project, and this is giving us beautiful results.
That's a
And
really
now
very
we
good.
have made it as a part of therapy that every patient will be getting means at least 3 to 4 times a day. And we are getting it
Fantastic.
supplied from our F&B, food and beverage
Fantastic.
department.
Fantastic. Just 1 minute left. I would like to just ask Dr. Jiba for the rehabilitation of this patient. Would you like to add 2 lines just for 1 minute? Then we
Yes.
will just close this.
Yes. So rehabilitation means coming back to normal life.
Yeah.
For the patients. Now, for the cancer patients, it is a long duration of treatment. I have told before also, some patients require 6 to 7 months of treatment. Some may require more than years of treatment. So the problem is that we have to address in 2 ways. One is that the patient himself or herself should be aware that this is a disease just like the other disease. It's not something which is capable of shaving him or her from the
Yes.
normal course of life. They
Yes.
have to have, this is our responsibility, because knowing that it is a cancer, or just the name cancer itself is very difficult to difficult to digest or accept. So it is our responsibility, the healthcare workers' responsibility, to make them understand that this is just like another disease and there is scope and hope for coming back to normal life. You have to go through the treatment, and then we will definitely come back and you will be leading a normal life again. Definitely.
Thank you. Thank you so much, sir. I will just, hand is raised by Mr. Shekhar. Sir, you just would like to say something, I think.
I want to say, as Captain Roy, she told, it is a regular practice in the Apollo to give the fresh ginger and fresh lemon and the rock salt. What I feel that it has been eliminated the Jofar MD for the patient who has a vomiting tendency. Actually, I mean, the other right demand. This is one. Second thing regarding the rehabilitation program. There are 2 types of patients. One is the fully cured, another is under remission, but they are in a healthy status. They are living with the normal life. If they are the senior citizen, so there's no question of getting any job, because we know our society even as on date. There are some young people, they were working somewhere, but due to this disease, they were eliminated. So I have one request to the all hospitals. You have the CSR program. Why didn't you have some quota for the cancer patient? You have n number of things they can be used in your different department, in the sense those who are related to the cancer, like admission process, so even the supervision, it may not be 8 hours, 12 hours shift change. So this is one suggestion. There are a lot of people, I'm very sure they are in a position and they have been happy. Money is not the factor. It's the question of their engagement, their fight, recognition of their fight, that they had come out from their problem. So this is my suggestion. Kindly, if possible, kindly look into this issue.
Sir, we have taken wholeheartedly your suggestion, and we will try to organize such. Fantastic. You have very well said this. It's very, very important to recognize the patient, those who are fighting and have overcome with all the agony. So thank you so much. So Madhukaridi, now over to you. We have to close this. 1 hour is just over.
Thank you so much, Dolly, for beautifully moderating it. And I am sure that entire session has given all the attendees a lot of thoughts, lot of insights, lot of to-do list for us, that yes, we have to take it up. Probably we have not thought of it before, and now we'll be thinking and we'll be taking it, especially hearing from directly from horse's mouth, who is Mr. Shekhar. You have enlightened such good points to us that we caregivers today onwards will have to think again from a different perspective.
Correct.
Probably we were doing something, but we were still not putting ourselves in the right perspective. We'll have to put ourselves and we have to do our best. Thank you, Mr. Shekhar, for giving us and enlightening us with your mind, with your thoughts, with your 10 years experience. And it is very, very enriching experience which you shared today with us. At the same time, it goes without saying that Dr. Jibak, your inputs were tremendously helpful for all of us. But there are a lot of things that we at times take it very lightly, or maybe we are not keeping it as our priority. But yes, you have given us those tips which will keep ourselves on a top priority of the things that you mentioned during your deliverables. Thank you, Dr. Jibak, for spending time with us despite your busy schedule. Thank you so much, and we will look forward to have you time and again to hear from you and get a lot of learnings from you. Thank you so much. Thanks, Sriparna, for your valuable time for this session, because as a nurse, we have a lot of things to do, and that will be taking us forward to give us the patient satisfaction and as well as patient safety. So both are very, very important. Sriparna, you highlighted many good points from your experience, and again, that's a lot of learning for all of us. And now I'm taking up to our dietitian is that just 1 second. Shravani, thankful to you because you play, as I will not say, our advocate. Today's advocate is Mr.
Yes.
Shekhar, who himself told that dietitian plays a major role in the recovery of these patients. So it goes without saying again that you play a major role, and you said, you have mentioned all these, that how important, what diet is important, what diet to be taken on priority, and how it is to be taken. That's really a very good tool for all of us, and we nurses should not overlook what patient is getting diet, because that is part of the therapy which we should take as a top priority for us. It is not only the treatment. We nurses are also supposed to be seeing what dietitians are prescribing, whether patient is getting right diet, whether patient is not getting right diet, is equally our responsibility. So we will take it forward. And now we have Rakhi with us as a counselor. I think, Rakhi, you have done beautiful sharing with us that your role is equally important in the recovery, because you play a major role from the time patient enters in the hospital and patient goes out of the hospital, because the way you will counsel the patients will give entire service so smooth, and patient will feel good about all the factors. So actually you beautify the service. So thank you very much for being a part of this, being a counselor, and you also have an active role in recovery of the patients. I think we all are indebted for all these partners. Ultimately, it works wonders when we do as a multidisciplinary team, and everyone in the team has responsibilities. As Dolly was saying about rehabilitation, as Dolly was saying about, it ends with rehabilitation, and that's how we can see Mr. Shekhar is having, every day he walks 5 kilometers. That's not a small thing. That's wonderful, because I'm sure with all these people contributing to your care, sir, you are today so fit, so fine, and we really pray for your recovery, pray for your good life and a healthy life, another 10 years and much more. So all the best to you, and all the best to all of us. Thank you very much for the attendees, those who have attended the session. I am sure that you have could enrich your knowledge. Thank you so much. And ultimately it goes to Dr. Runmana, please, to close it. Thank you.
Captain Madhukari, I just want to appreciate the hard work that you have initiated, and Dolly, that so many things from the beginning you are doing, and ultimately with your diverse team, the session was really very wonderful. And thank you so much, Captain Madhukari, that from leading from the front. And looking forward to have the better session. And my gratitude to each and every member of the talk show today. And I'm sure all the participants are delighted and lot of take-home messages. I earnestly request within few seconds, click into the feedback link and so that you can receive the certificate. That's all. That's all. Thank you from my bottom of my heart. Thank you once again.
Thank you once again.
Thank you so much. Thank you. Thank you, sir. Thank you, Dr. Jiva. Thank you, Shiparna,
Thank
Rakhi,
you.
Savani. Thank you so much. So just take time to fill the feedback form.
Okay.